All right,
Hello.
Ted.
So welcome to the August monthly info share session. We have with us Lynn from SDS, Cassandra, and then we have special guests from Healthcare Services and from Conduent. So a couple of housekeeping things. Everyone should be muted, and you'll have to chat with us to ask questions. So make sure you could find the questions or chat button, so that way you could, write in any questions that you have. I just want to make sure that you understand, if I don't read your questions, and we'll have time for questions at the end. Just in case I don't read your question, we might get duplicate questions, or we might get the same question asked in different ways. We'll try our best to read everybody's questions and paraphrase them, but we are recording this, so we'll have a record of everybody's question. We want to make sure you guys know your questions are important to us. Like I said, we're going to be recording this, and this is going to be available on our YouTube channel sometime next week. And I think that about covers all the housekeeping. I'm going to pass it to Lynn. Lynn, go ahead if you want to get started.
All right. I just want to say welcome to everyone. I know this has been a long time in coming for us to be able to address some of these issues that folks brought forward. And I want to thank you first and foremost for being here and for bringing some of these issues forward to us, because we are definitely wanting to address them. So can you go ahead and show the slides? Are you showing those?
I will make Ms. Mary Lee the presenter so that she can show the slides.
That'd be great. And I'll keep talking through a couple of the first slides. I think I have the first three.
Okay, are you seeing my screen at all?
We can see your screen. We can't see the slides yet.
Not the presentation. Gotcha.
And while she's getting that together, if you look in your handout section, we have put a handout there. It's the PDF of the slides that you'll be seeing today.
So if you go to slideshow, then they don't have to see all the notes and everything. There you go.
Right. Okay. Are you seeing?
We can still
see
all
the
your
notes.
We can still see all.
Okay.
You might want to swap your screen, Miss Mary Lee. If you have two screens, just swap your screen.
Somebody needs to sing a song, Lynn. I don't know.
There we go. I don't have any songs. Well, I have songs.
More technical difficulties here.
Yeah, you do not want to hear my songs. Let's just say that.
Prepare something for next time. Okay, I think we got
want to keep care coordinators. We do not want to send you all packing because I sing horribly. So to the next slide, Mary Lee, please.
Yep.
So here is a background of the issues. So that's what I wanted to sort of talk about. How did we get here? How do we get to the point that we are having to have this this conversation? Well, prior to COVID, as you all know, telehealth was prohibited for home and community-based services, care coordination, all of our services. Once the emergency hit, we worked really hard to get this out very quickly so that you wouldn't have to go out to deliver in people's homes. We wanted to keep people safe, keep you safe, keep us safe, everybody safe. So that became our priority. And unfortunately, we used sort of the phrasing of distance delivery, and but you are doing parts of telehealth, And it made it very confusing, just the language, the messaging between us, our partners, you, everyone. And so obviously we're all a little confused. You communicated that to us, as you should have, and as you have a right to do. And voila, here we are, next training. So let's go to the next slide. So one of the things that came out of this is that we discovered that the legislature required, because there was such an addition of telehealth, that the Division of Corporations, Business and Licensing create a registry for businesses that are going to conduct telehealth to register in. Initially, it was thought that our home and community-based services, care coordinators especially, or specifically, would be required to register in that directory. I didn't even know about that until recently, until maybe some of you brought it to my attention. We reached out as a department to the Director of Corporations, Business and Licensing and said, hey, I don't think this really meets the requirement. And so we were able to talk to her. She's very, Sarah Chambers, she's the director over there, was very, very reasonable, said, you know what, you are right. Let's remove them and not make them do the telehealth registry. So please know you do not have to register for that telehealth business registry anymore. Next slide, please. So another important decision is I wanted to show you right away so you can view the slides that Marilee is going to present in healthcare services in a way that won't make you panic too hard. So healthcare services, they're going to review telehealth modalities. So we consider you delivering a distance service, but you're using a telehealth modality to do it in some instances where you are using a phone or video. So we have to train you on that, and you have to understand what the requirements are for those. And why is it important that we actually record how the service is being delivered? Well, it helps us when we're talking to the legislature about how important it is for us to be able to use telehealth, for one, how important it is to deliver our services out to rural areas. And we won't know how often or how prevalent it is unless you use the right identifiers in the claims, because that's really the only way we have to determine when it occurs or when it doesn't occur. So when you look back at the pandemic, and if we started sometime in March or April of 2020 doing this work, and we were not recording it correctly with place of service. But for us to go back at this point in time and go all the way back to that pandemic time would be a struggle for both care coordinators and for the state to have to figure out and assist you in that and make sure that it's done correctly. And so we made a decision that we will be here to argue through an audit from the PERM or legislative audit for the state. So we made the decision that we would only require care coordinators to amend back to March 1st of 2022. So the reason we chose that date is because a new place of service code was added. That was number 10. So that's what we're here to talk about. And healthcare services did send out remittance advice. They sent out training materials. But I think the most important thing is that we realized we were not as clear as we could have been at SDS. And between the both of us, that's why we're here. We got together, we're doing this training. And hopefully for some of you, you were doing it since March 1st. For others of you, we want to be able to give you clear guidance on how you record it, what you need to record, and how you would do that. And so those are the two important decisions that I wanted to be sure to tell you about. Is you do not have to register for the Telehealth Business Registry, and you will not be required to go all the way back to the beginning of the pandemic when telehealth distance delivery started. We were only go back to March 1st. And I'll turn it over to Marilee after this and save our questions for the end, as Kat had said before. You can go to the next slide, Marilee.
Okay, all right. So what we're going to be talking about for the rest of the training is we are going to go through a frequently asked questions list with 11 of the most common questions that have come up from care coordinators and the answers to those questions. After that, we are going to look briefly at the public health emergency telehealth expansion. We're going to talk about telehealth documentation. So that's really mostly, as Lynn said, looking at that new place of service code. We're also going to briefly discuss a couple things that were sort of ongoing issues and some common errors that come up. Then we're going to look at claim submission in the 3 different formats that you are very likely submitting your claims in, and we're going to look at specifically where you put this place of service code. And we're also going to look at, for each of those submission methods, how you would go about doing an adjustment. So we're going to, for this specific topic. So we'll kind of go over that, and then we'll look at some additional resources. We're going to be hearing as we go through. I believe Lynn is going to have some additions kind of as we get to certain points. We may get some comments from Carrie Silvers or some of the other folks at Department of Health, Division of Healthcare Services. So we'll be hearing from a couple different voices as we go. And as was stated earlier, we will definitely have time for questions at the end, but for right now, if you have questions, just type them into the chat and we'll review and then answer them later. All right, so starting with the frequently asked questions. And this isn't necessarily a question that's been asked ahead of time, but we do use the phrase telehealth modalities a lot, so we wanted to sort of start out by defining it. Telehealth modalities are the modes or methods that you use to deliver services at a distance. So that might be an audio conference platform, it might be Zoom or Skype, or a specific telehealth platform on the internet. It might be phone, it might be a couple different things. Specific guidance on covered modalities is going to be coming out shortly. Please be aware that this is an evolving situation. And that's been true throughout public health emergency, and many of you have come to training over the over the course of the last couple of years, and we've talked about where you can find this. But question 2 sort of gets out ahead of that as well. Where will I see any new guidance information when it comes out? So first off, you are receiving e-alerts from Division of Senior and Disability Services. There's also a telehealth page on MedicaidAlaska.com. It has all of the telehealth resources together. You get remittance advice messages both in your statement from Alaska Medicaid, and they're also posted on the remittance advice message page on MedicaidAlaska.com. And there's these are live links, so you may be receiving this from the organizers, and also it's going to be posted on the training page on MedicaidAlaska.com. So if you're familiar with that, you can go to the training materials page, and this will be posted there shortly. All right, and a reminder about remittance advice messages. They're official communications directly from the state of Alaska to you. You are required to be aware of information that's published this way. And as I said, you can get them publicly on the website, or you can just check out your weekly statement.
And this is Lynn. Marilee, if I could just add, e-alerts are required for certification, and whether or not you read those, that's really up to you. Same goes with remittance advice, but when we're rolling something out like this and we are actually putting, that is our official form of communication. So when we show that you receive that, Whether you know the information in it or not, we're going to expect that you should know the information in it, and that is the standard we're going to hold you to. So please pay attention to e-alerts and pay attention to remittance advice messages. Those are the official way that we communicate with you. And that's what I would say about that. Thanks.
All right, awesome. Thank you. All right, and then also, as was touched on earlier, even though the service you're providing is distance delivery, you're using a telehealth modality to do that. So that's kind of where those intersect. All right, moving on with the questions. What services are authorized to be delivered via telehealth modality for care coordinators? And you would be using this for your monthly face-to-face visits. What claim indicators are needed to declare a face-to-face visit was done via telehealth modality. And what you're doing here is you're using one of the two telehealth place of service codes to indicate the visit was done through a telehealth modality. There's two possible place of service codes that you might be using. One is 02, the other is 10. We're going to be looking at the differences of those later, but actually in the next thing. So the difference between place of service code 2 and place of service code 10 is you use 10 if the member or their representative is at their home, at the member's home. If they're at any other location, you would use place of service code 02. And then later on, when we look at the billing methods, we're going to look exactly at where those go on the claim forms. Right, question 6, reimbursement for a face-to-face visit includes several activities done throughout the month using multiple different modalities. What's the correct place of service code to use when multiple modalities are utilized? Your reimbursement for the encounter, it does of course include multiple activities. You're emailing with the patient or with your recipient, you're talking to them on the phone, you're doing other administrative tasks. The place of service code applies to the face-to-face encounter. If the face-to-face encounter with the member is done via telehealth modality, then you're using one of those two place of service codes of 2 or 10. Right, next, what is the definition of home when you're determining the correct telehealth place of service code to use? Alaska Medicaid uses the definition of residence that you would find in the Code of Federal Regulations in 440.70 to define home as it's related to the correct telehealth place of service. So home is where the member lives, with exception to a hospital, nursing facility, or intermediate care facility for individuals with intellectual disabilities. If the member does live in a group home or an assisted living home, then that is their home when you would use a place of service code of 2 or 10. Right, question 8, can you make in-person visits even during this public health emergency? The answer to that's yes. You may use telehealth for your face-to-face visits, but you don't have to. It's the member's choice on what modality is going to work best for them. Question 9, if a claim for a face-to-face service done via telehealth modality was submitted without the appropriate telehealth indicators, do I need to void that claim? No, you can just do an adjustment to indicate use of service code of 2 or 10. There shouldn't be any financial impact on these adjustments that are done within timely filing because the same fee is paid regardless of whether the person is in person or whether the visit is in person or using telehealth. So there shouldn't be any financial changes. Next question, Lynn already talked about. So you only need to make corrections back to March 1st of 2022. And then of course, from this point on, you want to make sure you're using that correct piece of service code going forward. I do want to just kind of note a thing about adjustments. If you, for some reason, want to go back farther than that, you absolutely can do that, but be aware that if you try to adjust the claim outside of timely filing, the amount that was previously reimbursed on that claim would be taken back. So I would encourage you to not do that. So just a really important safety tip. If for some reason you want to go back farther, still stay within timely filing. And you know, as was mentioned before, you don't have a requirement to go back any further than March 1st of 2022.
Good point, Marilee. I failed to mention that earlier, but I think that is a really valid point. I know some people want to cross all their T's and dot all their I's and make their records completely perfect, but we're telling you, you do not have to do that. And we will, you know, we're reinforcing it through this training, and there will be information, further information on our website about the March 1st date. I've already made contact with Program Integrity, so it's really important that you understand you do not have to go back prior to March 1st. Go ahead, Marlene.
Okay, awesome, thank you. All right, okay, and then the final question has a two-piece answer. What's the difference between a procedure code or procedure modifier and a place of service code? A procedure modifier is a modifier that you would add, and you can see what this looks like in the service line item in the health enterprise price claim entry. And it would look slightly different if you were using paper or PayerPath, but not that different. So it's something you use when you want to make the procedure or service a little more specific. You're bringing further specificity to that service. So the example we give here is your procedure code is T2022 for care coordination visit. But if you are providing a care coordination visit for the ISW program, you want to add the letter CG as your modifier, because then that modifies it and says this is care coordination, and it further adds the detail that it's for an ISW program. I do also want to use a side note for this, just because it's something that kind of came up, and it's something that's recently been a bit of an issue. If you are providing care coordination services for a member in the ISW program, please do use this modifier. Not using this code is a pretty common reason why claims have been suspending and denying this service. So please do use that. And also on the same note, the services you're providing do not fall in this category, don't use this modifier, because there's been some confusion around this modifier. Now that's a totally side note to what we're talking about as far as the care telehealth, but it's an important one. Okay, so that's a procedure modifier. A place of service code is where you're indicating where the member is during the encounter. It doesn't really define the service, it just makes it clear where the patient was when the encounter happened. So the member's location is what takes precedence, where you're determining where the encounter occurred. So in Health Enterprise, you see the definitions of the codes. So you will see either either telehealth or telehealth away from the person's home. In PayerPath, or if you're using the CMS 1500 claim form, you'll see those two character codes, 0, 2, or 10. But just look at the definition. So that's the difference between procedure modifier and place of service code. All right, so next we're going to talk a little bit about the expansion of telehealth coverage during the public health emergency. And I think we all know it's been in place for a couple of years. It's been a pretty broad expansion. So the purpose of the expansion was for recipients to remain safe at home while they're still getting needed services, allows providers and you as care coordinators to maintain safe distance while you're still providing your recipients with the services they need. And for those recipients who do in fact have COVID-19, they can stay in isolation, and that helps prevent the spread of disease while they're still getting their services. So the initial public health emergency expansion of telehealth services went into effect March 20th of 2020. It's been in effect for the duration of the public health emergency, so it has been in place this whole time. There have been changes to the program and updates and new things, and the new telehealth place of service code on March 10th was just one example of that. There's been changes. And care coordination, face-to-face visits for home and community-based waiver services are authorized to be provided via telehealth during the COVID-19 public health emergency. All right, next we're going to look at documentation. And these are steps that you need to make sure you're taking when you're billing for services that were rendered via telehealth. It helps support your claims. It helps make very clear exactly what happened and how it happened, if you want to be precise about this. So one thing that's important is that members do need to be informed of the type of connection that you're using during the telehealth visit and whether it's secure or unsecure. And they do need to give oral or written consent to move forward with the visit once they have that information. documentation on file does need to indicate that informed consent was given orally. You want to refer to your scope of practice regulations for some services that may require written consent before you do treatment. For your care coordination note, information about patient consent to communicate via telehealth method can just be an additional to your usual documentation. And Lynn or Kat, did you have more that you wanted to add on that?
Yeah, so this is something that is new and is a requirement under telehealth. And, you know, I've heard from some folks that sometimes you don't know where someone is when you're delivering the service. You know, if you're having a phone call with them, or that's something that you should know and you should ask and you should document. And the same thing goes for informed consent. So it's a requirement that you have it in your, you have some kind of written consent or some kind of documentation for this. But the easiest way that I could think of would be in your note when you're doing telehealth that you have talked about it. So create a checkbox in your note, something that says you have received consent. Kat, is there anything you would add to that?
No, I think that covers it. Yeah, thank you.
Thanks.
Okay, thank you. All right, so it's important to remember that telehealth services are documented episodes of care, so you need the same documentation that you would if you were seeing the member in person, plus that documentation that describes the telehealth visit. And that's what was just being discussed about the note that, you know, got consent for the using the telehealth modality and documented where the person is and so forth. Consistent with provider record keeping requirements, members' records need to include the need for telehealth services. So your requirements include general documentation requirements as identified in Title VII, the Alaska Administrative Code, Chapter 105.230. And for anybody that's been to guidelines for record keeping, that's the record keeping regulation, basically out on alaska.gov, Alaska Administrative Code section. Documentation of the method that you are using and the connection you're using. So methods would be live interactive, store and forward, etc. And the connection would be encrypted patient-facing application, Zoom, Skype, phone, whatever the case may be. Identify where the recipient and provider are located, and really the recipient's location is the more important thing. You don't need the address of where they are. You can just say home or, you know, away from home, or where, you know, just generally where they are. Statement that members given informed consent for services via the technology used, and documentation that describes the services provided and methods of delivery. Right, so place of service codes is a whole code set, and you can find much more about that should you be curious or, you know, kind of want to look into the things that are available. You can find that out at the link here, cms.gov, and you can follow this link, or you can just go to cms.gov and type in place of service codes, and it'll pop right up. So these are included in professional format claims to indicate where the services were provided. It's important to have a correct code in this field, as claims need to accurately describe the services that are rendered. And of course, as Lynn was saying earlier, it helps for, you know, breakdown of how services are being provided. It helps demonstrate the importance of being able to do care coordination via telehealth and show the breadth of how often this service is happening this way. So it's just important on a number. So the ones that you are going to be doing for telehealth are either 2 or 10, as we've discussed already, but there are a number of other common types of situations. So you'd use 03 if the services happen in a school, 04 in a homeless shelter, 11 in an office, 12 in, you know, physically in the person's home, 13 in an assisted living home, 14 in a group home, 16 in a temporary lodging, or 18 in a place of employment. And as I said, there's many more codes, and this is where you can get to those should you want to. All right, so those are your options for place of service code. These are the 2 that are important for what we're talking about today, but just be aware it is a whole code set. All right, now we're going to look at claim submission. National billing requirements, including required data fields and values, are determined by the National Uniform Claim Committee and published annually. may know that there are claim form instructions on MedicaidAlaska.com with Alaska Medicaid specific requirements for your claim forms, and whether you're submitting on paper or electronically. But that claim format was created by the National Uniform Claim Committee. They do have a website with lots of good instructions and more general information for submitting claims, so that's always a good resource. And the key thing that we're going to be talking about here today, again, is the place of service codes for telehealth. So you're using 10 if the member's in their home during the telehealth visit, 2 if they're anywhere else during the telehealth visit. All right, so the main modes that you have to submit claims are through Health Enterprise or PayerPath. They're probably the most common ones. We're also using the paper claim form, the CMS 1500 claim form. You may also be submitting claims using the A37P transaction type if you're using practice management software. We're not going to look at any examples of that, but just be aware it would look kind of like the PayerPath fields, or it would look like the Health Enterprise fields, and it kind of depend on how your software is formatted. And there are companion guides on MedicaidAlaska.com to help you with that, and that's a good place to go, or your implementation guide for details on where you would put those place of service codes. All right, so starting with Health Enterprise, you can submit claims through Health Enterprise, which is logging in at MedicaidAlaska.com, and then just going to put in a claim. And I will just put in a little plug here. If you are billing on paper, you may want to consider doing this. It's free. It's pretty straightforward. You can create templates for your commonly submitted claims. You can check claim status, do adjustments, and void the previously paid claims. There's a lot of tools there to make it easier, and your claims will process more quickly than if you were submitting on paper. So that's just an option that's there. All right, so we're not going to go through the whole claim submission process for the claim options. We're just going to look at where place of service codes go here. So when you get to this point, you would have filled in the patient's demographics and so on and so forth. But when you get to the claim line item, the place of service code is where you want to put that one of those 2 options. So you either use telehealth if they were anywhere other than their home, or telehealth in the patient's home. If they are in fact in their home. So that's pretty straightforward. It's a drop down here. Your options are in alphabetical order. So those 2 options should be right next to each other. So you just want to select whatever it is, fill in the rest of your claim line details, and then always do the little save in the portlet here. As I mentioned, creating templates, this is a tool that can be really helpful for you. You can create templates that are just sort of general with your information in them. You can create a template for each of your patients or your recipients. Kind of do whatever you want. So you go to claims, you would go to create templates and create professional templates, create a name for your template, and then continue. Fill in all the consistent details that are always going to be the same. If you're doing it per patient, your patient's information and the diagnosis code and the procedure code and your billing information, and then you'd save the template. Then when you go to bill with it, you would hover over claims, create claim from template, up your template, fill in your details, and then submit. So that can make things a little quicker. And one of the things that you can, of course, set in there is the place of service code, or you could leave that as something, if you have patients that are kind of different places when you communicate with, recipients that are different places, you can change that up. Great, so as I mentioned, we're going to talk about how to do adjustments for each of the billing methods. So if you do need to do adjustments back to March 1st to fix the place of service code, this is what you do. So if you were submitting your claims through Health Enterprise, you can do adjustments through Health Enterprise. If you were submitting your claims another way, we'll talk about your other options over the next couple slides. So you start by, I'm going to click back just a little bit here. You would go to claims, create claims, and then create a professional claim. You would not use a template if you were doing an adjustment. The first thing you see is this question asking if this is a void or replacement of a previously processed claim. That's always true. And the default is set to no, and that's what lets you go ahead and do a new claim. But in this instance, you want to change your radio button to yes. Under resubmission type code, your options are void or replacement, so you would want to select replacement. you would want to type in the TCN for the claim that you're adjusting. And then when you tab out of that, your claim data will populate. You can go down, open your line of service. All you would want to change is that place of service code. And then you would go ahead and save the adjustment, and that should just process. So that's the short answer of how you avoid or how you do an adjustment using Health Enterprise. We do an adjustment void class as part of our regularly scheduled provider training, and we do talk about this and the other methods for voiding there, but just briefly, we've already done it. That's what you do for this. All right, so the next thing we're going to look at is PayerPath, and here I do want to thank Denise Shelton. She was kind enough to provide some screenshots for us, which would not have been able to do this part really very well without her. So many thanks to you, Denise. All right, so in your line of service area, you just fill in all your extra stuff, like you usually would, your date of service, your procedure code, your charges, your diagnosis player, etc. Your place of service code is in base B here, and you're using 2 or 10. If you are using 2, it should be 02, because this does need to be a 2-digit code, and if it's not a 2-digit code, it will deny. Okay, so that is all you have to do there. So if you need to do an adjustment in PayerPath, again, you can only adjust claims that were originally submitted through PayerPath. You would start by clicking on View Claims, then choose the circle for transmitted. Then you would enter your date range for the claims that you want to, when you're looking to the date range for the claim you're looking to adjust. If you get an error message, you would re-enter your dates, hit apply filter again, and it should go through for replacement or corrected if 7 isn't already populated there. Okay, then you would have a list of your claims for that time period and that meet those filters. So you want to find the claim you want to adjust and then click on the V for View button. Then you would go down to the bottom and click Rebill, which is going to be on the bottom bar on the right. You would change the resubmission code, and that's spot 22, right here underlined in red, to the left of your original reference number. So this is where the TCN goes, and then you want to change this to 7, and 7 means resubmission code. Okay, so that is how you do an adjustment in PayerPath. So the last method of billing we're going to look at is using the paper claim form. So this would be using the professional format CMS 1500 claim form. And again, looking just at the line item, your place of service code is in field or column B. And this, you'll notice, looks very much like the PayerPath screen. I'll kind of scroll up a little bit. As I mentioned, there's claim form instructions that will walk you through what goes in what fields. And PayerPath looks very, very much like the paper claim form. So it's a little bit more of a one-to-one thing, whereas Health Enterprise and some of the practice management software does present a little bit differently. So 02 or 10, as we've been talking about. So the final method of adjusting that we're going to talk about is one that will work no matter how your original claim came in. The adjustment void form, which you'll find on the forms page on MedicaidAlaska.com. And you want to scroll down on that page and you want to go down to the other forms section at the bottom, and it's right at the top. The second page of this form is instructions. So if you're just not quite sure what they're getting at with the fields, that's a good place to look, or you can call in and provider inquiry can help you out. So what you want to do is select adjustment, fill in your provider name, your billing provider number, the information about the claim that you want to adjust, and then you're just noting the line number that needs to be changed and all that needs to be changed. So you're changing a place of service code from whatever it was, possibly 99 or whatever, to 02 or 10 or whatever the case may be. You can add any comments that you would like to include. Then you do need to sign this and date it. And you want to make sure you look at the note at the top here. So you want to include a copy of the corrected claim. So you're going to add in a copy of the new correct claim, which is going to look exactly like the original one, except with that that new place of service code, and a copy of the remittance advice showing the paid remittance or the paid claim and when it originally processed. So the copy of the corrected claim is to make it 100% clear exactly what you want that claim to look like once the adjustment is done. The copy of the remittance advice page that shows the paid claim is just to prove that you're within time limit. So those two things do need to be adjusted or do need to be included, and you want to mail it all in together at the address at the top. So if this is the method that you want to use, making sure you take care of all those pieces is going to make your adjustment process quickly. Okay, so there's that. Again, we do an adjustment void class as part of the usual training that we do. And additionally, if anybody would like to just kind of walk through one or two or has questions, please feel free to contact me. You may already have my email address. If you don't, on the Medicaid Alaska website, there's a training page, and you get there through documentation, documents and forms, and then provider training. And if you DL, the delivery list for training, that'll get to me and a colleague, but I'll answer it. So you can send in there. All right, so that is really the bulk of it. There's some resources also in this presentation. So the telehealth fee schedule isn't really going to have anything specific to your fees or anything. You know that you're included. There are some bits of information about telehealth and how it works in there, so that might be helpful. The temporary expansion of Medicaid telehealth coverage just links you to some documentation about how the telemed update works or the expansion works. And then these are links to just general resources. So there's a provider updates page on MedicaidAlaska.com, and that gives you, a listing of all the updates that have been published. And that does include things about telehealth, but also many other topics. Remittance advice message page, and that's also on MedicaidAlaska.com. Department of Health webpage, Division of Behavioral Health page, and then also the telehealth page. And that's on MedicaidAlaska.com. And then finally, our website, and I know you know this address because I've said it probably roughly a million times, but still good to know. There's billing manuals, fee schedules, the telehealth page. There's claim form instructions. There'll be a copy of this presentation posted. Should you have any telehealth policy questions, Carrie Silvers is there to offer guidance. If you have questions about waiver services, about care coordination, then Kat is reachable at carecoordinationsupport@alaska.gov. And you can contact our provider inquiry team, or as I said, I'll be glad to help you with any one-on-ones on adjustments. All right, and that is what we have for telehealth services for care coordinators. So,
do we have any questions, Kat?
Yes. So I try to kind of group the questions together so I don't ask the same questions over and over. And just really quickly, if I don't get through all the questions, Marilee, would it be okay if I had sent you a list that you could maybe answer and we could send out? Because there's been a lot of questions.
Yes, absolutely. Yep.
Okay. So there's a bunch of questions about why do care coordinators have to go back to March 1st and not bill using those codes starting today when they actually got trained on it. There's quite a bit of questions about the decision that was made to start this in March.
I can answer that. So when you go back and you look through remittance advice, and it tells people how to use 0, 2, and 10. You're doing telehealth modalities. It's really important that you understand that when you're providing the service under that, you have to be able to follow the remittance advice. And so everybody knew they were doing telehealth. You should have paid attention to the remittance advice. There were specific trainings about it. And we are being very, I think, thoughtful about the fact that we don't want you to have to go back farther than that. When actuality, as soon as we started using a telehealth modality in March of 2020, there is in the billing manuals and in the trainings information about using place of service. And most people know to put place of service on their claims. So that's why we made the decision that we would go back to 3.1 when we added place of service 10, and there were even more trainings available. And that's why we made that decision. What's the next question?
There's a lot of questions about RA messages, saying that the RA messages are not opening and haven't been opening for some time. One care coordinator noted that it's been about 2 years that they cannot read RA messages.
And I would have to defer to someone at Healthcare Services, but I'm wondering if the care coordinator has talked to Healthcare Services about that they can't read RA messages.
Oh, this is Crystal Nichols, and I will just add that there are multiple ways to view remittance advice messages. If you have a provider portal and you receive your RA through that portal, there is a PDF version of your RA, and the remittance advice messages will be right on the front of every RA. If you prefer not to view your whole RA, you can go to our website, and Marilee has it showing already. There's a tab at the top that says RA messages, and if you go there, there's a historical archive of all RA messages. And I actually think at this point it goes back 15 to 20 years. But every RA message that has ever been published is available here. And if you click on the link, it is a simple PDF that you can open.
I'll also note, thank you very much, Crystal. When you're on this page, if you don't want to scroll through everything, you can hold down the Control and F buttons, and a search box will pop up. And you can just type in whatever term you want to look for, and the system will scroll you right through it. So that's another option you have to make that a little easier.
And this is Lynn. One other thing I would say is that I realize it has been confusing, but technically we should be going back to the time that we authorized this under Appendix K for you to use telehealth modalities. We recognize at SDS, I recognize that we didn't give clear guidance on that, even though because it was the height of the pandemic, as I described before. And so asking you to go back to March when we've started to get clearer and clearer on it, I don't think I know it's a work, and I'm not saying it isn't work. We appreciate you participating and being a part of that solution, because the alternative is that we could go forward from today, but when a lot of people have been doing it correctly. And so we make sure we're fair and thoughtful about that, and that we are meeting the guidelines as they're intended from CMS and from the people that oversee the billing. So again, unfortunately, we do need you to clean up data with those place of service codes to, from March 1st forward.
So there's also a lot of questions about informed consent. And do care coordinators have to go and get retroactively consent, basically retroactively get consent? Is the consent required to go back to March 1st, 2022? Is there a form that they can use? Can you talk more about that?
And this is Lynn. It's something that I haven't really talked about with our partners at Healthcare Services yet. But I would say it's hard to get informed consent when you already have done the modality, right? So you can't go back and ask, well, did you inform me prior to the point that I already have given the service? So I think from this point forward, you need to get informed consent now that you do have this training. And I would say, I don't think there's a form or a format necessarily. You just need to, basically, if, I don't know if she can pull up that slide again, Marilee, but it basically says you have to document that the person that you're giving the service to agrees to and understands what is involved with this modality, confidential, the type of modality you're using, and that they agree to do it. So it's.
Do you have to do that, sorry, Lynn, do you have to do that every time, or can you do it once per consumer, or is it at every visit?
This is Carrie. Informed consent, it should be done at each visit in regards to your patient or your the member should know that, you know, telehealth is being used. They agree to the telehealth being utilized. They agree to the format that's being utilized. One important thing to think about right now is, right, because of the PHE, we might be using some unsecure modes. They should be aware of that each and every time. And there are no forms, Lynn, that we have. This is something that should just be presented to the member. The member should agree, and then the care coordinator should write down that they agree to the telehealth.
And that's why I was saying it might be easiest to just add it to your note, add a checkbox to your note that says, or something that says informed consent applied, or something, so that you, that we are aware, and your notes provide the fact that you have given the statement to the individual that you are, you know, using this modality and what the risks are with it.
And this is Marilee. If I can throw in a tiny little bit on this. Some of you I know have been to our regular telehealth for providers training, and we talk a bit about secure and unsecure modes of delivery. So if you're using a patient-facing portal or, you know, secure telecommunications method somehow or the other, that's secure. And that's normally what would be allowed. But during this public health emergency, the federal government has allowed use of things like Zoom and Skype that aren't necessarily 100% secure. And then they also issued guidelines about things you can do to make things as secure as you can. So if you would like to delve into that a bit more, the telehealth presentation is posted on that same training page for anybody that's not aware of that. And I can just show you real quick where that is. So on MedicaidAlaska.com, if you go to documentation, documents and forms, go to provider training, on-site and webinar, and here's the schedule for upcoming trainings. But you want to go to training documents, and then the telehealth presentation is right here. And there's a whole section on what's up right up to it. So these are the normally allowed modalities. And then here's a discussion of secure and unsecure. Here's a discussion of the basis legally for being allowed to use some of those less secure methods, what can be used, what still can't, like TikTok and Twitch, and those potential methods for being as secure as you can. So that's a good reference for a little bit more detail on the secure, unsecure factor.
And this is Lynn, once again. I think it's really important for care coordinators to be a partner with us on this, because we are, you know, hoping to continue to do this into the future for care coordinators. And I think, you know, you have proven, we have proven together collectively that it is a valuable service to be able to allow you to do distance delivery using a telehealth modality. And it's important, though, that you understand that you have to understand what telehealth entails. So pay attention when we're talking about telehealth. And I know for some people they have thought, well, I just do distance delivery, it's not really considered telehealth. It's not telemedicine. Like, we're not prescribing, we're not doing something, we're not delivering a therapy through this device like this. But it is really important that we are on the same page about the fact that you still have to meet certain requirements to be able to deliver this service. And we want this to succeed. We want to be able to do this going on into the future. And so for us being able to describe the amount and extent that it happens, and that we have these things figured out and we are following the rules, I think it's really important. And so I just can't stress that enough, that you are our partner. And I know it seems like another hoop to jump through, but at the same time, it's giving you some flexibility that you have never had before prior to the pandemic. And I think it's a valuable one. So I just want to make sure that we're partners and that we are all doing what we need to do to make sure we ensure this in the future.
So we are out of time, but we have a couple more questions. So Marilee, if you don't mind, and Lynn, I'll probably send you a list of some of questions that we didn't get a chance to answer. Maybe we could issue some more information to care coordinators. There's some specific questions about POS codes and other things. But thank you guys very much for participating and spending time with us and answering maybe not all, but a lot of the questions that we've had.
Right. And we can leave it open for like for a couple of more minutes so people can get their questions in. And that way we could gather all the questions and send them to you.
That'd be great. I'm happy to help, and I'm pretty sure Marilee would be. Again, thank you so much to our partners at Healthcare Service and Conduit for participating with us and putting together this webinar. It's super important. And again, and thank you to care coordinators for actually bringing all the questions forward and making us realize we hadn't given you enough information and needed to do that. So thank you for using your voices.
Care coordinators, if you have any other questions that you questions pertaining to this session here, you can put them in. We'll give you time to ask your questions, and we'll try to get answers for you later. But please put questions pertaining to this session. Thank you.
Thank you. Thanks for your time. Take care, everyone.
Thank you.
Thank you.
I'll just leave it open for a little bit.
Yeah, I was gonna say we still have a couple of questions coming in, so yeah.
Yeah, I'll leave it open so they could get their questions. And once almost everyone leave, I'll close it.
Yeah, that's fine. Be easier to make sure we answer all of them.
Yes.
And are we turned off to public?
No, let me turn off, but I still want to get their
We
questions.
only have a couple of people left. I think there's still questions kind of trickling in, so.
Yeah, that's good. I'm hoping they'll put them all in there.
I think we're good, Cassandra. I don't see any more questions coming in.
Okay. All right. I will end the
We're always
webinar
getting
for
in.
everyone.
Thank you.
All right. Have a great